one of the members of the SLAT team, our senior living advisors, and Jamie is also our transitions nurse. So welcome, Jamie.
Thank you, Jennifer. Welcome, everyone. As Jennifer mentioned, I'm a senior living advisor at Bluestem Communities, and I am one of the 3 senior living advisors on the team. We are the first people prospective residents and families work with in any transition at Bluestem Communities. We help people discover the best living and care arrangement for themselves or a loved one, so we are well versed in the details and benefits of each care level, and also at assessing individual capabilities and needs. We give tours, manage the wait list, discuss financial details, and coordinate transitions to different levels of care. Janelle Bontrager is a senior living advisor for independent living and the first point of communication for prospective residents looking at independent living. Janelle works with prospective residents to find the right independent living home for them. Carrie Lindeman and I are senior living advisors for assisted living and healthcare. We assist independent living residents, community members, and families as they consider assisted living and healthcare options and navigate the process from time of inquiry to making a transition. We know that navigating levels of care can feel overwhelming. You likely already have some understanding of the benefits and amenities residents in independent living have available to them. But as health and care needs increase, what happens next? How can you help your loved one discern when it might be time to consider a move to a higher level of care? What do those settings involve, and what does the process look like? When you came in, you were given a resource about the spectrum of care available at Bluestem Communities. This piece details the 3 main care settings at our life plan communities. Within these 3 settings, we also have specialized programs. Though for now, we'll be focused on a general overview of assisted living, healthcare, and the transition process. Before we go any further, we understand that listening to this kind of information or having these conversations can be uncomfortable. Transitions or moves like these often come with unexpected circumstances, but it's so much easier to learn and begin to understand all the pieces when you're not under the stress of an emergency situation. We'll start with the care setting that is a step above independent living, assisted living. We often describe assisted living as choosing to focus on the parts of life that bring you joy and fulfillment because you have the support for your everyday task. As we have conversations with prospective residents and families, it's not uncommon to hear the assumption that residents in assisted living lose their independence and choice. In reality, assisted living is ideally a choice someone makes when things are fairly stable for them. It's like living independently with just a little extra support that extend a person's independence for even longer. In assisted living, nursing staff is available 24 hours a day if needed. Nursing provides medication management and care coordination, including collaboration with physicians regarding medication, appointments, and other medical needs. We also provide 3 meals a day as well as snacks, housekeeping, laundry services, life enrichment activities, and chaplain services. When these tasks are often taken off your loved one's plate, they're given the gift of more time and energy for the life-giving activities they choose. Like independent living, assisted living offers some choices in floor plan and building location. Likewise, multiple shared amenity spaces and a variety of life enrichment activities and other socialization opportunities invites residents to be as social and active as they choose. In general, the time to consider a move to assisted living is when day-to-day tasks are taken up by all of a person's energy, leaving no room for the things that they find enjoyable. A fulfilling living experience means having some time and energy for family, friends, hobbies, and other things that bring them joy. If getting ready in the mornings, keeping up the house, or taking care of medical needs leaves no room for the things that a person loves to do, then it's time to take a few more things off their plate. Another indicator may be that parts of their daily routine are becoming increasingly challenging for them or keep having health setbacks that they're not bouncing back from. A common misconception is that residents always move from independent to assisted living. That's not always the case, especially if somebody needs to move urgently for health and safety reasons. As typical in life, the plans we have for this part of our lives don't always work out. The journey changes depending on choices, timing, and other things out of our control. There are qualifications for assisted living, and if you remember, assisted living is designed to maintain as much independence as possible. Hopefully, you'll recognize that those qualifications are fairly moderate in terms of care support. Sometimes it can be difficult for our loved ones to recognize or be honest about their physical challenges in order to identify the best setting that would meet their needs or before a crisis. It can sometimes also be difficult for family and friends to accept those challenging realities. But for their benefit, it is important to view the situation as objectively as possible. This is one of the ways that Carrie and I can help. We want to meet with individuals and families so we can start by getting to know their lifestyle and situation. We can then provide resources, insight, and recommendations when to consider making a change and to what setting would be most beneficial. When it's determined that someone's care needs are beyond what assisted living environment can safely or legally provide, then healthcare is likely the best option. Healthcare is designed for residents who need a higher level of assistance with physical or medical needs. This can be for a variety of reasons. Residents benefit from availability of staff and nursing care around the clock. The care is customized to each individual's needs, so even in this setting, residents maintain as much independence as possible. The care can also vary from day to day, because sometimes we all have better days than others. The benefit of healthcare is really there's full support available for good days and for the bad. Other services and amenities that are provided are personal care, medication administration, management of medical needs, care coordination, transportation to appointments, housekeeping, laundry services, a full dining plan, chaplain services, life enrichment activities, and restorative services. Someone might benefit from healthcare if living alone or being independently mobile has become a safety concern for themselves or others. Or maybe there's been a decline in their physical abilities, they're having difficulty with thinking, memory, or safe decision making. We find that if somebody is moving in a crisis, such as because of a sudden major change in health status, healthcare is almost always a setting where that person would move. Sometimes people need to move to healthcare first to recover from an illness, then, if they're able, transition to assisted living. Bluestem Communities offers a few special programs in healthcare. Both Kidron Bethel Village and Showalter Villa have the option of skilled nursing, sometimes also referred to as short-term rehabilitation for people who need a little extra care following a hospitalization, surgery, or illness. Both campuses offer specialized memory support and dementia care for residents who have trouble thinking, called Comfort Matters. This is an evidence-based philosophy and care practice that provides a holistic and integrated approach to improve quality of care and life for people living with dementia. Showalter Villa also offers a high-functioning memory support neighborhood called Hess Plaza. It's for residents who are very capable physically and live an active lifestyle, but who have moderate dementia and trouble thinking. This neighborhood has a dedicated life enrichment coordinator who helps maintain a high level activity and engagement opportunities. No matter where a resident is on the care spectrum, Bluestem Communities is dedicated to meeting their unique needs and providing a fulfilling experience. Both assisted living and healthcare are very different places than they were even 10 years ago. As we learn more about person-centered care and become more proficient in it, it changes how we operate. Today, assisted living and healthcare are environments where care is resident-directed as much as possible. We'd like to take this opportunity to address some concerns about assisted living and healthcare that we hear frequently. Will staff make residents participate in activities even if residents express that they would prefer not to participate? No. Residents can be as involved on campus as they want to be, regardless of the setting or the neighborhood. If they enjoy social interaction and activities, there are many opportunities for them to connect. If they prefer a private lifestyle, that is fine, and staff will respect that. Will residents have to get up and go to bed at a certain time? No. Staff get to know each resident personally and cater to their bedtime and rise time. What's the food like? That's an important question. Can residents choose to eat what they love? A variety of foods options are offered, and special diets are accommodated according to care needs and a person's wishes. All prepared meals have a window of time that they are served, and residents can come and go as they please during that window. There is also a 24-hour menu available for snacks throughout the day or night. Assisted living and healthcare residents are welcome to dine at any of the 3 Bluestem Community restaurants for no additional charge. Are all healthcare residents bedbound? Absolutely not. The healthcare setting meets a variety of needs. Residents at all care levels have opportunities for campus activities as well as off-campus outings as they are able. Do assisted living residents need to be accompanied wherever they go? No. In assisted living, as long as residents sign out so staff knows that they're not in the building, they can come and go independently. Sometimes residents ask staff, who's in charge of making me move from independent living? The answer is they are, or perhaps them or their family. Outside of a medical emergency, each person is in charge of making the decision to move. In rare circumstances, staff or social services get involved if a resident's behavior in independent living is becoming a danger to themselves, others, or property. This is a last resort and can be a very distressing experience for everyone involved. On the flip side, if people have the most control and choice when making the decision for themselves, it's something we've learned makes the best experience for residents and families. It allows them to choose when to move, where to move, what to take along, what to do with the special items they aren't taking, and have enough well-being to learn to know the setting, staff, and fellow residents. Staff also benefit from this because residents are able to express their preferences and interest to them, so they can offer opportunities and care in a way that fits the individual. Of course, a sudden change can happen to anyone that requires an emergency transition. Outside of that, every person's circumstances are different, and again, that's where the senior living advisors come in. We want to help residents and their families recognize when it's time to consider a higher level of care. We aren't here to pressure anyone. We are an advocate and want to provide information, resources, insight, and recommendations to consider so it's a better, less stressful experience when the time comes. When transitions to a new level of care do happen, especially when transitioning to healthcare, they can happen in all sorts of ways based on where the person is coming from, their medical needs at the time, and other factors. We could spend all day creating different scenarios. For a planned transition and not a crisis, when the resident is directing the where and when, the process can look a little more typical. The main steps are shown up here on the screen. We won't go into detail on these steps today, but on the resource table in the back is a sheet that spells out this process. You're welcome to take a copy with you. Regardless of the circumstances around a transition to a higher level of care, a senior living advisor will be a guide for the resident and the family until the actual commitment or move. Senior living advisors, myself and Carrie, walk with people until a home is available and they are ready. When those pieces have fallen into place, the nurse and the social worker join the process, and we all work together for a period of time for the pre-admission steps. Once a person moves to their new home in assisted living or healthcare, the nurses and the social workers become the primary staff contacts. Tonight, we've given you a broad look at the different levels of care, as well as when and how to get more information or initiate a transition. We are sure you have many more questions, and we want to give you an opportunity to ask them. We've invited residents and family members who have gone through the process, as well as additional staff members, to come and help answer questions in a panel format. I'll invite them up at this time. I'm going to have them pass the mic so they can introduce themselves.
Good evening. Can you hear me? Okay. I am Carrie Lindeman. I am one of the senior living advisors for assisted living and healthcare. I work with Jamie in that regard.
I'm Katie Raleigh. I'm the social worker here at Kidron Bethel, and I work in healthcare and assisted living.
And I'm Shelby McCauley. I'm the Director of Nursing here at Kidron Bethel.
Good evening. I'm Jenna Snyder, and I'm the Director of Nursing over at Showalter Villa in Heston.
And I'm Rosie Gehring, a happy resident in assisted living.
Randy Gehring, her son.
And I'm Julie Gardner, the Assisted Living Nurse Manager here at Kidron.
Thank you, guys. Does anybody in the audience have, you can keep that. Does anybody in the audience have any questions? Just raise your hand if you do. Okay. We're just going to ask a few questions to Rosie and Randall. Rosie, can you tell us about your transition and why did you decide to move to assisted living from independent living?
Well, yeah, my husband and I were living happily in independent living with the gardens and the walks behind us. Oh, that was great. But I found myself getting more breathy all the time, and my doctor called me stage 4 kidney disease. And, it just seemed like I needed to think about that as an RN. I knew what that meant. And then my son said, well, maybe you ought to put your name in an assisted living because they have a long waiting list.
Thank you. Randall, what were the positive changes you saw once your mom made this transition?
So I'm going to speak from my standpoint and then what I saw as positive for her. So, I have retired, but was a geriatric physician, and so I also will speak a little from my experience with other patients and families. I think there's often a tension, and there was for us, between the family's perception of safety and security for Mom and Ray and the feeling of wanting them to be independent and them wanting to have their independence. And it's often hard to navigate that tension to the satisfaction of all concerned. So I think that my siblings and I were feeling not worried, but feeling like things weren't as secure. If there was a minor illness, a urinary infection as an example of that, that could sometimes become a pretty significant problem for a short time, and then recover back to the previous level of function, but an increased risk of falling or things like that during that time. I perceived that Mom didn't like cooking or doing the laundry much anymore, and those were real positives.
I'm just going to ask. Rosie, how did you know it was time to make the change?
Yeah, I don't really remember exactly, but, I love to garden, had little gardens behind us, and I really just couldn't do a whole plot at a time because I just got too breathy. And then, of course, I looked at the figures for my kidney disease, and they weren't looking good, and it just seemed like it was time. And then I also thought of, well, somebody's going to do my laundry. What's not to love about that? Somebody's going to clean my room. What's not to love about that? And I don't have to cook. What's not to love about that?
I'll let you keep that. How's the food?
Well, the food is good. Breakfasts are really my favorite meal, and the food is good. Now, we always have choices, lots of choices, and sometimes there aren't enough choices, but, and it becomes institutional food, but Ray and I like to go out to eat, and he's still driving. He's 95 and still driving. And so we'll go out and have a hamburger or something like that. And for Christmas, we requested the grandchildren to give us gift certificates to Wendy's and McDonald's and et cetera, and so we've been taking those in consideration, yeah. And the food really generally is good.
Wonderful. Will you just give us an idea of the day in the life in assisted living? Like, what does that look like? What are some of the highlights that you look forward to?
Well, I look forward to breakfast every morning. I have my favorites. Today was one, biscuits and gravy. And then usually we go to our room and read the papers if they're available. And I catch up on Facebook, and there might be some activities that have been planned or that you can go to. There are actually enough activities to where you have to make choices. In the afternoon, always take a nap, yeah. And there are lots of times to visit, just back and forth. Actually, I don't know how many we have in assisted living now, but every one of those people is one of my friends.
Maybe Julie can tell us how many we have right now.
We have 23, but tomorrow we'll have 25. We have 2 admissions tomorrow.
Okay. Randall, what advice would you share with family members who are helping their loved one make this decision and or this transition?
I don't know that, yeah. It's difficult. Downsizing is difficult. It feels irreversible to make this move, and so it's kind of hard to make that final decision that yes, we're going to go there. So it does take some working and planning. Again, from my career experience, it is sure better to do this when things are stable than in a moment of crisis. And from my perspective at least, it's better to move too early than too late. But I'm not sure Mom and Ray agreed with me at the time when we were talking about that. While I've got the mic, I want to say what a great job and what a great security it is for me to have Julie and the nurses that are taking care of residents the way they would take care of their own parents, and I really appreciate that.
Thank you.
Well, one of the things that as you are getting ready to make that decision, people always say the apartments are too small. But I have found, and I thought it was too small, but I have found that whatever we have now is what we need, and we don't need anything more.
Okay, thank you for that. Does anybody in the audience have any questions for staff? Okay. Nope, there we go.
How long is the waiting list?
Right now, we have apartments available. Yeah. So, and if somebody wants to be on a waiting list for the future, that's also a possibility. Do you want to give any insight on that, Carrie?
No, if you,
give you this.
Like she said, they are available right now, and we are happy to sit down and talk through more things in a different setting by ourselves, but give us a holler, and we'd be happy to sit down with you and, you know, talk things out a little bit and give you maybe a little more information and go from there.
I had a question. What is your name, ma'am?
Rosie?
Rosie, okay. So, how do you feel about the possibility of transferring then to healthcare at some time?
How do you feel about the possibility of transferring to healthcare at some point?
Yeah, well, as I said, I was an RN in past years, and I know enough about physical things that I know I will probably have to move sometime. I have refused to have heart surgery because I was 91 years old, and I didn't think it was necessary to do heart surgery at this point in time. So I know what my outcome will be. I will move to healthcare at some time, I think, and I will probably go into hospice care, although Brandy and I haven't talked about that yet, but I know that will happen, and I think I prepare myself for that. Did I answer your question?
Yes, and you have a really good attitude.
Got one.
You said there were a lot of activities. I was curious what those activities look like.
Well, today there was men's coffee, which of course I could go to, but I understand they had wonderful cookies. And before that, we had a little painting class, and I painted an Easter egg, which just turned out kind of beautiful. There's always a movie with popcorn on Fridays. We can count on that. There are several chaplaincy-led groups like Bible study. Oh my, help me remember some more. What?
Exercise in the morning.
Oh, exercise 3 times a week, yeah.
Bingo.
Oh, bingo, can't forget bingo. And we play for prizes.
And if I could just add to that, I'm the director of independent living here, and residents in assisted living are always welcome to come to the events that are happening in independent living. It's not like once the move happens, you're no longer allowed to come to independent living events. So there's all of those available as well. Plus healthcare events. Thank you.
Is it pretty routine that if one of a couple needs the assisted living, that both of them move?
So on assisted living, both members of the couple have to qualify independently. So if one of them is struggling and not able to meet the assisted living criteria, then that person may have to move to healthcare while the other one may move to assisted living or may choose to stay in independent living. But they have to qualify independently just in case something happens to the spouse that's healthy. If something would happen, then what happens to the other one? Because we don't have the staff to take care of that person's needs. So that's kind of how we look at it. So it's not an automatic that that they both can come at the same time.
Does anybody else have any questions?
Can we say something about?
Yeah.
I don't know that we've mentioned so far about what is available for when you are feeling bad. Several times I've had kind of a thing on blood pressure, and you know, they were right there, blood pressured me, made decisions, called in an RN or whatever. And my husband has twice had a diabetic reaction, rather severe, but the nurses were all there and just right on the button for us.
I've got a mentally handicapped sister that I take care of, And I suspect she will bypass assisted living, and she's currently in independent living, and would go to health care. How many personal items would she be taking along with her?
So in healthcare, the bed, dresser, and nightstand are all provided. So her personal items would be a recliner, a TV, pictures, her personal hygiene, clothing, that kind of thing. But the furniture is pretty much provided other than the recliner and the television.
All righty.
I think Randall had. Oh, yeah. Randall, did you have something additional on this?
I was just going to add on what Mom said about the when there's an emergency, there's a resource there. I think we've avoided several emergency room visits as a result of that resource being available.
Thank you. Okay, anybody else? Okay. Well, Rosie or Randall, is there anything else you guys wanted to?
Check my checklist. No.
Sure.
I think we got them.
Perfect, perfect. Okay. Well, thank you again for coming this evening. Please remember that the senior living advisors and the staff at every care level are here to simplify the process, answer your questions, and make transitions as smooth and stress-free as possible. Information gathering can happen at any time, whether a transition is around the corner or years down the road. Just call us and we can start with whatever feels the best for you and your loved one, a face-to-face conversation, or maybe a walk through assisted living and healthcare to observe and ask your questions. And of course, if having more support within the next year might benefit your loved one, encourage them to complete an application so they can get on the waiting list for assisted living or healthcare. Bluestem Communities residents do receive priority if there's limited availability when the time comes for a transition. But filling out an application and joining the waiting list means that you'll keep in touch with them when there are openings, that we will keep in touch with you when there are openings, and it gives more choice of home location, layout, and timing. One last reminder that there are additional resources available for you to pick up as you leave, and staff is also going to be around after this to answer any individual questions. Thank you, everyone. Does this turn off, or does he turn it off?
In case you want to ask a personal question, we're available.
Thank you.